We are very excited that our first patient completed her 3 vaccinations on our phase 1 study of an anti-MUC1 vaccine that is aimed to prevent invasive breast cancer.
I am honored to get this vaccine because I hope that other people will volunteer to get the vaccination and that we will have enough individuals that will step forward and take the high road and help us find the cure.
So this trial is for women who are diagnosed with pre-cancer, ductal carcinoma in situ. Our vaccine is against a molecule called MUC1, and that molecule is abnormally expressed on the first pre-cancer cell that is generated in your body. The important thing about this is that if the immune system gets rid of the cancer once, it will keep getting rid of cancer forever. Meaning if new cells begin to grow, the immune system will recognize them, will have the memory of this first cancer, and it will get rid of it.
Our hope is that we can use the vaccination to allow the body to recognize these tumor-associated antigens and figure out a way to fight pre-invasive cancer. If pre-invasive cancer can be stopped in its tracks, then invasive cancers do not develop. And maybe we focus the rest of our decades of research in preventing cancers rather than treating them.
So at Girls on the Run, we believe that every girl should boldly and joyfully pursue her dreams. So here at our one-week camp, we want girls to be able to see strong females in their career positions, and that's why we're here today at UPMC. Today we got to meet with dietitians and Dr. Myers, who is showing the girls how to do casting. So they're learning about ways to fuel their bodies and keep healthy bones.
So we are partnering with Girls on the Run because it is a fantastic organization that works on building confidence and activity level in young girls. And being a pediatric orthopedic surgeon, I think it's very important to make sure that kids are being educated on exercise and activity and how to build healthy practices for the future. Their mission really aligns with a lot of our values. So just focusing on inspiring confidence in girls in this age group and making sure that they are aware of all of the possibilities that are open to girls. Orthopedics is still only 15% female. And so I think it's really important for me in particular to just work with young girls and show them that there's any manner of opportunities out there for them. And then as an orthopedic surgeon, to be able to work with an organization that really focuses on exercise and activity is just a huge benefit.
So this week we are fortunate to have our AI summer school, particularly for high school students, and specifically we are interested to teach them about medical imaging informatics.
I've learned a lot. Like there's been a lot of presentations and a lot of really educated speakers that we've had. And so it was just really fun for me to explore this part of computer science that I've never really interacted with before.
Well, I think in the future, AI is really gonna take over a lot of our things that we do in our daily lives. So I feel like it's really important that we really kind of understand where it's going.
It's very important to get their hands dirty with those kind of components in an earlier fashion so they can better learn what we mean by safe AI, what we mean by unbiased AI. And they learn fundamental algorithms, fundamental concepts that could be applicable for other domains.
Yeah, so this is what we call a smart interactive health vending machine. It has free health items. It can also connect people to services. So we have a list of local resources if they need additional help. And this vending machine really came out of the COVID pandemic and the increase in overdoses we were seeing and a need for low barrier access for Narcan and life-saving items. So initially it was conceptualized as a naloxone or Narcan vending machine, but kind of grew because we realized there are a lot of other health needs that the community has. And so this came out of a nice partnership between Penn State, UPMC, Dauphin County, and also a lot of community organizations giving us their input about what would be beneficial for the Harrisburg community.
So in the first month of service, it has recorded 500 separate items dispensed to about 100 individual users. And what we noticed is the most common things were pregnancy tests, personal hygiene kits, and Narcan. And going forward, that may change, and this is basically like an iPad-based product. So we'll be able to track what's needed. Users can also input data saying, hey, I wish you had X or something else, and then we can see if we need to change the things that are in there.